Hello everyone, welcome to our podcast where we discuss about safety, hazard and safety measure in hospital. I'm Firdaus and I'm your host, Muhammad Firdaus Pemolpi, and as a student in Politeknik, Sultan Salahuddin Abdul Aziz Shah. And today's episode focus on the hazard and safety measures in the hospital. We've joined two experts here, Safety Officer Mim Arshad Mustafa and Dr. Timothy Jonathan Jelinas. Thanks for being here.
Thanks for having me. Can't wait to dive into this important topic.
Yeah, absolutely. We're glad to be a part of this conversation.
Alright, let's start. Let's start with the basics. In hospital setting, a hazard is anything that can cause harm. Hospitals have many hazards, from wet floor to exposure to infectious disease. Recognizing hazards help us to create a safer environment for both patient and staff. Let's take example. If there is spill in a hallway, it's a hazard because someone could slips and fall. Identifying it help us know to put up a sign and clean up quickly. Alright? A safety measure is any step we take to reduce the risk of harm from this hazard. Alright? This could mean anything from putting a wet floor sign to wearing gloves to prevent infections. It's all about reducing the risk of accident. Alright? Let's take a simple example. A needle disposal. Used needles are a hazard because they can carry infections. The safety measure here is to dispose of them in sharp containers immediately to prevent accidentally injuries. Now, to recover the basics, let's dive into a specific hazard safety measures. I'll start with two, and then we will hear from both of you guys. Okay?
Right.
First one is hazard in hospital: fall and slips and fall. I'm sorry. Okay. Even the simple spill can lead to serious injuries, especially in freaking busy area. You know what I mean, right? You know what I mean? You know what I mean?
Yeah. That's my thing.
So the safety measure that we take about from the hazard is to put up a wet floor sign right away to clean up spills immediately to prevent accidents. If a nurse notices a spill, they put a sign and call it housekeeping. It's a small step, but essentially this step can prevent injuries. Another significant hazard is needle stick injuries. Used needles pose a risk of infections is mishandled. Let's say a doctor, after drawing blood, accidentally pokes themselves with a used needle. This can lead to serious health risks. To prevent this, hospitals use sharp disposal containers. By disposing of needles right away, we reduce the risk of the needle sticks. A nurse immediately places a used needle in sharp containers, avoiding potential injuries. Alright. Safety officer Mim, based on your marvelous experience, could you share a hazard you've encountered and how you manage it?
Usually, there's one big hazard in hospital we deal with is chemical exposure. Hospital use strong cleaners and that can cause respiratory and skin irritation if mishandled.
Can you give an example of how this might happen? Right? I think for sure the listener or the viewer want to know about the example.
Sure. I imagine a staff member cleaning a room with a bleach-based product without PPE. They could inhale fumes or get the cleaner on their skins, causing issues. Our safety measure is requiring staff to wear PPE like gloves, masks, and goggles when necessary when handling these chemicals.
Hmm. Is PPE required for every cleaning task?
Not exactly. PPE is most required for tasks involving harsh chemicals, though we encourage gloves as a basic precaution even for routine cleaning.
Alright, enough from you. I want to hear from Dr. Tim, the leaders.
Yeah, sure.
Alright. Can you give me a hazard and a safety measure? I mean, like the first hazard and the first safety measure.
Yeah, sure, can. I will start from hazards. Infectious diseases are constant hazards. The healthcare workers are often exposed to patients. So, with contagious illness, which puts both staff and patients at a risk.
Can you give me an example of what are you saying?
Yeah, can, sure. The example, imagine a nurse treating a patient with the flu without protective gear or proper hygiene. They could can the virus and potentially spread it. Yeah. To prevent this, we enforce strict hand hygiene protocols, like washing hands between patients and using hand sanitizer. Yeah.
How do you ensure everyone follows this protocol?
For example, after creating a full flu patients, we make sure to wash our hands and use hand sanitizer before moving on another patients. So minimizing germ spread.
For me, like another hazard is ergonomic strain, especially for nurses lifting patients or heavy equipment, which can lead to back injuries.
Do staff actually use lifting aids?
Usually, in most of the hospital, we provide lifting aids and train staff on proper training lifting techniques to prevent strain injuries. For instance, when lifting a patient, we encourage using mechanical device and remind staff to lift with their leg, not their back.
Alright, let's move to you, Dr. Tim.
Yeah.
Give me another example of hazard. I mean, like not example, but give me another hazard from you.
Yeah.
Based on your experience, okay?
Okay. For my second hazard, okay, is a blood-borne pathogens. Yeah. A serious hazard when handling blood samples, as they can carry harmful viruses. Yeah. For the example, imagine a lab technicians pricking themselves, okay, accidentally while they're disposing of a needle, exposing themselves blood-borne pathogens. So the safety measures to minimize risk, staff wear gloves and dispose of needles in sharps contents right away. Yeah. So when the handling blood samples, healthcare use the glove and disposes of needles in designated sharps of containers.
Oh, I love the meaningful what you say. I mean,
Yeah.
like you know what I mean.
Yeah, sure.
I love to hear what your experience.
Yeah, thank you.
Let's move to Dr. Safety Officer Mim Mustafa. Can you give me your last hazard from based on your experience?
Medications error are another hazard. With so many patients, there's a risk of giving them the wrong medication or dosage.
Do the example from what I say, I mean like how this could be happen.
For example, it's a busy shift and a nurse accidentally grabbed the wrong medications from the cart due to similar packaging. Our solution is using electronic medication administration system that verifies patient information and dosage. When a nurse administers medication, the system checks for the correct dose and patient match to prevent errors.
How about you? Your last hazard and your last safety measure. The question from me.
Yeah, sure.
I'm sure all the viewers want to hear more about you, Doctor.
All right.
More about you, Doctor.
Okay. From me, the last hazard from me and safety measure. So the stubborn hazard is a radiation exposure. Okay. So in a radiology, staff exposed to small amounts over time face potentials, long-term health risks.
How does this type of exposure happen?
Okay, for example, an radiationally technician performing X-ray without protective barriers might force exposure over time. Yeah. So the safety measures, okay, staff wear a lead aprons, yeah, and monitor exposure levels to keep it within safe limits. So the example of the safety measures, when the performing X-rays, radiology staff wear lead aprons and monitors daily exposure. Yeah.
All right.
That's one thing.
All right. Thanks. I think that's enough from you guys. Thanks for you guys joining me today in this podcast.
Yeah, sure.
It's really helpful for the viewers to take some knowledge anyway to prevent any hazard and make the safety things is the important one. All right. So for everyone listening, remember safety in hospital is a team effort for you guys. Okay.
Yeah.
That's all from us.
Thank you.
Thank you.